All righty. So, good morning, Commissioner. We are recording here on Sunday, July 26th, and I think it's about 95 degrees out already.
Oh my goodness, 20 weeks in, Ken. My goodness.
20 weeks in, 20 weeks in. So we have a number of ideas that we wanted to communicate to staff today, and I think that the first one is the fact that we recognize there is so much information coming out now regarding email and videos and webinars and tutorials that it's very difficult at times to prioritize a lot of what is happening. And so we wanted to make sure for this week that we focused on two pieces of information that came out this week. The first one was a summer safety flyer that was distributed to all staff on Thursday.
Yeah, you mentioned how it's 95 degrees already, and that flyer talked about water safety and just supervision and those types of kind of highlights. And we want to make sure that when we share those, that information, particularly those infographics, that our staff who are in communication with the clients that we serve are sharing them, whether they're electronically or printing them out. But we want to, or if it's even imparting the information that's on there. I think this week we started to look at the number of burns that we've gotten, whether it's with liquid burns in a bathtub that's, kids move so quickly, things happen in an instant, or their heat sources. And so on that flyer, there's different types of things that families and parents should be paying attention to that we just want to highlight and have our staff reiterate when they're interacting with parents.
Exactly. And we know that things happen, as you mentioned, kids move very quickly towards a hot iron or pulling a cup of hot tea off of a table or jump in a pool. So really the point is putting together a document that is easily readable and distributing that to our families would be helpful. Earlier in the week on Monday, we had our Telework survey, which again is really important for staff to spend the 15-20 minutes it takes to fill out, because that's going to give us information about how our remote technology and in our environment are working to elicit feedback from staff. Certainly we have the COVID-19 mailbox where as recently as today, I just checked, we have individuals asking questions. But can you talk a little bit about the importance of that Telework survey and how it's also connected to other things generally in the department?
Yeah, so we thought there would be another way to gather information. Like you said, the COVID mailbox has been really helpful. People just sharing their ideas and their concerns. We know that, the pivot to the remote environment hasn't always been smooth, but we had to do it really quickly. And so if there is opportunity to learn from things that we could have done better, or things or suggestions that staff have that reflect what went really well, we want to try to be able to capture that in the survey. So that was sent, the link for that was sent out earlier this week too. So I just wanted to highlight it in this week's video to remind everybody to take a few minutes to do it so we can get some feedback from that. The other thing that I think that survey results will feed is our resuming full operations. We've been talking about that now for probably a little over a month, as we had to develop a plan of reopening, that we use in quotation marks because we haven't closed. But we have that centralized process of kind of coordinating all the efforts that engineering and our systems folks are leading. But we also want to make sure that our local implementation teams are feeding a broader dialogue at the department about, what physical spaces are ready, what's still needed, what other supplies might be needed now in the short term as well as long term. And all of that is going to come from information we receive from these different sources. So the survey is one of those things. That also brings us to, I think, a conversation related to the next topic for today.
Yeah. So the help desk. As we are in this environment of remote technology, our help desk has been, to say the least, inundated morning, noon, and night with requests. I think right now about 50% of the requests that are sent to the help desk have to do with connectivity. And as we were talking earlier, what we want staff to to think about is prior to actually calling or sending in a ticket to the help desk, can they review the circumstance that they're having problems with their supervisor? Because at this point in, and I think you said it at the beginning of the video, we're now 20 weeks into this new environment. There are situations that others have encountered that have been figured out that maybe could be more quickly resolved than by creating a new help desk ticket. And when it specifically relates to connectivity, the rule of thumb is if your technology is giving you problems, the best thing is unplug, turn it off, shut everything down, pause for a minute, restart everything to see if that simple intervention would help. Can you speak a little bit about that?
Yeah, I just, our help desk has been tremendous. You know, this is an opportunity that none of us could have anticipated or expected. And it's a small group of people who have had to not only make sure our phones are right, but our tablets, our laptops, our, you know, all of these other ways to stay connected. 365 migration happened during this time. And people were also trying to connect with their own devices, and that creates some challenges. So, you know, they have done a yeoman's job at keeping up with us, but they're only so, you know, there's only so many of them as well. So if we could do our part to try to limit, I know, because I'm, you know, just as guilty as you are, as everybody else, of, you know, really quickly turning to the help desk to try to resolve every single problem. And some stuff doesn't need that level of intervention. And what we're finding at the same time is if we can ask for more support for our help desk, but in the meantime, can we try to talk with each other? You know, what I thought, Ken, is missing is that notion of when we are physically together, there may be somebody that knows how to do something through technology, that you just stand up, reach out, you know, look outside of your office, look over your cubicle and say, does anybody know how to X? We don't have that anymore because we're all kind of independent in our remote environment. So all of those regular day-to-day questions now seem to be finding their way to the help desk. And so that becomes just an enormous task for the limited number of people that we have. So if we could use supervisors to kind of help people navigate and troubleshoot some problems that maybe someone else has experienced or they might know the answer to, that might tamp down the volume for the help desk a little bit and see if we can't try to resolve that issue. So we wanted to raise that here, which brings us to another piece of a concern that we want to raise today, and that's the discussion about supervisors and supervision.
Yep. So we have Chronos that has been implemented, effective. It's a week now. It started a week ago Friday, and
the soft launch took off.
We have joked about, did you punch in, did you punch out? But I think Chronos really serves a number of purposes for us. It's an electronic way to keep time. It's an electronic way to approve time off and look at scheduling. But when we document the hours that we are working, it is also going to put us in a position where we need to then raise the work-life balance that all of us have. And as this week has gone by and I've tallied up my hours, I was taken back by the number of hours that I have had documented. And certainly you and I are here on Sunday doing this video. So Chronos, if you could talk, Commissioner, it's the electronic way to track the work, but it also serves a greater meaning as well for the agency and the personnel.
Yeah, just now when you mentioned it, I realized I didn't punch in because we're working right now. And, you know, the second, I think, memo that I sent in my role as commissioner had to do with this issue of supervision. And I couldn't stress enough that it's not the social work supervisor position that I'm talking about. I'm talking about everybody in the agency who has a supervisor or who supervises someone else, from me to the exec team, all the way throughout the agency. So, you know, we have a responsibility to make sure that what we are doing to support the workforce is in concert with what we are expecting from the workforce. That work-life balance is critical to be able to make sure that we can do our work of the agency, but that we have people that are in the right frame of mind to be able to make sound judgments and decisions related to kids and families. And part of that is a work-life balance. And so Chronos has technical and adaptive changes that we have to undergo in the culture of DCF. And so the technical piece is what we're seeing in the e-learnings, the town hall that we did to give people explanations as to how to punch in and out, how to schedule, how to maintain your time card and your accruals. But the other piece, the adaptive piece, is having supervisors know how much their staff are working, what they're working on, and having some parameters or limits to people who are just, doing too much and not turning it off. And, Chronos will have an opportunity for us to do that. So you want to make sure that you're tracking people's hours, but you are also supervising and having a conversation about logging off and where and what people are doing. Not from a punitive gotcha standpoint, but from I need all of you to be working at your best, at your capacity, but not burning the candle at both ends, so much so that we may have an opportunity to miss something that's very critical in our work.
Absolutely. And Commissioner, it's somewhat strange to say this, but speaking of work-life balance, this week we have Dr. Mike Schultz, who is retiring after over 2 decades with the department. And I don't think there's been anybody who has paid more attention to the well-being of staff, to ensure that we are okay during those times of the utmost crises in our work than Dr. Schultz. So I don't know how you describe what he has meant to us for the period of time that we've had him. And what not a lot of people understand is he actually delayed his retirement to stay and support staff during the pandemic in ways that are so unique to him. So, Dr. Mike.
Wow, Ken. Life changes and transitions during the pandemic have been really, really hard. And, there have been other retirements and people leaving, and we've been able to kind of virtually say, our appreciation. But Dr. Mike leaving, I think really is going to mark the end of a chapter. Because I do think that his work with our department has been a very unique role that he has played, and the way he has played it has been nothing short of just kind of adding another dimension to how we understand the person and the professional. There's lots of Dr. Mike-isms that I know that I use as part of my leadership development, and I certainly am a different person within the context of my work at DCF. Because of the exchanges that we have had over the years. And so, we appreciate not only his selfless act of staying with us during the pandemic. I don't know that anybody else could have shepherded our emotional well-being through such an uncertain circumstance than he. But it's also, when we think of work-life balance, have to help the helper. And he needs work-life balance at this point in his life as well. And so it feels right that this is the time. He and I had our conversation the other day, and he said, it feels right. And, although that's hard for me to hear from a professional level in terms of what I know he has contributed to my own emotional stability now and in the past, we will view fatalities differently. We will view the needs of our staff differently, and we will view the multiple dimensions of children and families that we work with very differently because of the work of Dr. Mike Schultz. And, we wanted to take a few minutes before we go over the data and the stats of the week to just say hats off. And thank you to Dr. Mike for helping us recognize that, this is a marathon and not a sprint. And that while we stay connected to each other, it's important that we take care of each other too.
Yep. And it's quite a legacy to leave the agency in the place that he has. With, I think there's the tangible ways people affect you and then the intangible ways. And I think we're all stronger because of his work, and we're more informed because of his wisdom. So
That's
hard to measure that, but it's there.
It is. It is. And as we take a deep breath of mindfulness, let's pivot to the
Statistics.
stats for the week.
Yep.
So we've seen no new cases,
Yep.
which I just think is a tremendous, tremendous reflection of all of the efforts that have been made in Connecticut to keep the transmission rate under 1%. I think the last time I looked, we were at zero point 0.6. Between zero point 0.6 and 0.79 in our transmission rate, and that is the number of positives per with the number of positives divided by the number of total tests that are taken. So we're still having, a really good testing cadence. We talked this week about some specific outreach to vulnerable communities,
Yep.
and the importance of testing and timely treatment, and really keeping that spread down and really helping people develop a trust in the overall system. But within DCF, we've had no new cases. So we are at 36 staff members, with
Yep.
35 of them having returned to work, 68 foster parents who have tested positive, and then 18 of our children in DCF custody who have tested positive but are now recovering. So we're holding steady, and we want to
Yeah.
still, pay attention to what that means for our larger picture.
We are. And again, as you have said, and we have said on this video numerous times, vigilance, vigilance, vigilance. A number of us were in central office on Friday.
Yeah.
We all had our masks on, and I have this vision of you coming in and us sitting in the same office on a Microsoft Teams call, but we were distance with our masks on.
Yeah.
And I looked over you. I thought, what? How crazy is this? But we have to take every opportunity to remain vigilant and practice those safety measures, because as you said, it is paying off, not just for our department, but for our kids, for our foster parents, and for people around Connecticut. So we can't predict the future, but we can just continue to do what we have been doing for 20 weeks. So
Yeah. So stay tuned, everyone. Thank you, thank you, thank you. Be safe out there.
you got
All
it.
right.
Have a great week.
Bye bye, Ken.